Hi all. So in our blood pressure series, let me tell what is the. Many people ask me what is the relationship between diabetes and blood pressure. So how we can control them and who is at risk. Is hypertension more important or diabetes more important to take care? So hypertension, it is even more important in diabetes care, right? So hypertension is pervasive in people with diabetes. Default 90% of the people who get diabetes are at higher chances of getting hypertension, and diabetic men and women have an increased likelihood of developing pre-hypertension if not full-blown hypertension. And pre-hypertension puts everyone, and especially diabetics, at greater risk of developing cardiovascular disease, and predicts that if left uncontrolled, hypertension will follow. The risk of developing cardiovascular disease for diabetic individuals is 3.6 times more great as that for a non-diabetic men and women with normal blood pressure. That's a huge differential in risk. And the good news after all those dreadful statistics that I hated is to give you is diabetes in general and hypertension in particular can be controlled, and complications and risk can be greatly reduced. It is not that, as other people say, once diabetes and hypertension is there, it comes along with a lot of complications. That is not good. It can be controlled, complications can be controlled, and the first step must be to make a commitment to yourself and to the people you love and who you love. Okay. And how in you can really control blood pressure, and controlling blood pressure can control diabetes. So in many ways you have a two for a price of one situation. The same lifestyle modifications which is being taken for diabetes is also required for blood pressure. In fact, the guidelines for the initial treatment of diabetes with a blood pressure reading of 130 by 139, 130 by 80 or 139 by 89 call for a 3-month trial of no drug treatment prior to starting a patient with antihypertensive drug. Initially, when we see the increase in the blood pressure, immediately there is no need to increase the medications. In many cases, we have to give the patient a 3-month trial through food to control the hypertension. And those modifications include weight loss, increased physical activity, reducing smoking, and moderation of alcohol consumption, and restricted sodium intake. Okay. And all this in detail you can know once you get in touch with this. And how much weight should you lose? Only you can give a honest answer to that. Only you can give an honest answer to that. If at all you are overweight by 15 kgs, at least reduction of 5 kgs can show a lot of impact in your blood pressure readings. And the wonderful thing is that men and women who lose a sufficient amount of weight and who become physically active can actually cure not only their elevated blood pressure but also diabetes itself. And the daily measurements of glucose and periodic test of HbA1c can show a return to normal levels, in fact, by losing weight. And the diagnosis of diabetes is tentatively made when blood sugar raises above 126. A definitive diagnosis is established by a reading of more than 7% on your A1C test. Conversely, when blood sugar levels fall below 126 and A1C is less than 7%, a person's diabetes is cured. Okay, I use the quotation here because once diabetes is established, the person must be vigilant on a lifelong basis to keep glucose and A1C counts normal, lest diabetes return. But for all practical purposes, your diabetes would be cured without the quotation marks. This means that the risk of developing cardiovascular disease and other complications of diabetes, including a potential kidney damage, blindness, and amputations, is greatly reduced. Isn't that worth working for a lifestyle modification? Yes, it is worth. Nearly all physicians feel that a vast majority of diabetic patients will require more than one drug, often as many as 3, to control hypertension. And most doctors will start with ACE inhibitors, ACE inhibitors, and will add other drugs as needed. And those drugs, of course, come with a raft of potential side effects. So it would be well worth your while to do your level best to get your blood pressure down without needing them. Your doctor won't be disappointed. Trust me when I say that more doctors would give a lifestyle modifications, more credence that, and be in less of a hurry to reach for a prescription pad if they felt that their patients would do their utmost to achieve the desired goals through weight loss, exercise, stress management, and so forth. It is us who have to give, we should give the confidence to the doctors that we are going to do lifestyle modifications. If the doctor has the slightest doubt that we are lazy, we are not ready for lifestyle modification, he will start you with the medications. Right? Sadly, most patients do not give this confidence to the doctors. It is not the physician's fault that they have added medications. It is our fault. Until and unless we don't give confidence to them, they will make sure they will give the prescription pad medicines, right? And prove your doctor wrong. Prove that you can lose weight and you can show them. Be in constant touch with them. Monitor your blood sugar levels and blood pressure levels. Yeah? And while working hard to lose weight and increase physical activity, you will also want to use a special weapons here. All those supplements, there are a lot of supplements which have shown to increase the level of nitric oxide, which is very good for to make your arteries flexible, elastic, and capable of dilation to allow for the increased blood flow as needed. They all have been shown to lower blood pressure. It's the pressure of the blood flow against less flexible and elastic arteries that we know as hypertension. Right, so there are a lot of supplements which can help you to treat diabetes or blood pressure before getting into touch with the doctor and before getting into medications, which can really help you a lot. Get in touch with your personalized nutrition advisors and let them help you out to cure this pre-diabetes or pre-hypertension in a very easier way before you get into any medications for rest of your lives. Decision is in your hand, lifestyle is in your hand, your food, what you take inside your mouth is in your hand. Thank you so much.